Welcome, everybody. So happy you can join us today. We decided, those of us in Big Ten schools, but other schools as well throughout the country, that we wanted to do something to ramp up wellness in our colleges throughout the Big Ten and country. So we have put together this wonderful faculty staff wellness series, 13 weeks every Wednesday at 12:30. So again, welcome. I'm glad you could join us. I'm Bernadette Melnyk, and I have the privilege of serving as Ohio State's Vice President for Health Promotion, the university's first Chief Wellness Officer and Dean of our College of Nursing. I also hold an appointment in our College of Medicine. The topic today is making the case for investing in academic wellness. But I'm going to start with a dose of vitamin G for gratitude. Gratitude is one of the simplest evidence-based practices that if we put it into action every day, will improve our mood and decrease our stress. So I want to thank each and every one of you for all you've done through this character-building COVID-19 pandemic and all you continue to do. I'd like you to take just a few seconds and put in the chat box who or what you're grateful for today. Well, wellness is the optimal state of living well, regardless of an individual's spectrum of health. At Ohio State, we have long focused on 9 dimensions of wellness, but we're actually moving to a 10th dimension, and that is digital health. Social media, in some ways, it's very positive, but it's also creating a lot of loneliness, especially in our college students throughout the United States. So building strong wellness cultures and integrating wellness onboarding programs and evidence-based programming in our academic programs is not a nicety. It's a necessity because right now we have a mental health pandemic inside of our COVID-19 pandemic. So I'm going to hit the business case first. I know we've got leaders tuning in today. The top reason why we at Ohio State invest the millions of dollars we do in faculty, staff, and student wellness is because we want our entire Buckeye family to be happy, healthy, and engaged. But when I talk to my president and my senior VP for finance. They want to know, what's the return on investment? A lot of studies have been done to show for every dollar invested in wellness, there's a $2 to $4 return. At Ohio State, our ROI has ranged between $2 to $3.65, which is great. So we fall right into that range. We also have to remember, if students are physically and mentally well, they will perform better academically. 2/3 of college students who are no longer at their college aren't there because of mental health issues. So the return on investment, we cannot look at this as an expense. It truly is an investment that has a big return. We have so much research to also show the relationship between wellness, productivity, between wellness and absenteeism and presenteeism. So there's tons of evidence to support that investment. Well, burnout, stress, depression, and suicide, even before COVID-19, we claimed we had a public health epidemic in clinicians and health sciences students. Our team has done a lot of national studies, not just with nurses, but other professions. And we have seen over and over again the very high rates of burnout, depression, anxiety, post-traumatic stress. I want to just highlight this finding from a study we did with critical care nurses across the United States. Not only were the nurses in poor physical and mental health, but those nurses in poor physical and mental health made more preventable medical errors. And we have seen repeatedly in our national studies, the longer the shift work, the poorer the health, and the more medical errors that are made. We've got to stop 12-hour shifts. They're not good for our clinicians, and they are not good for patient safety and quality. Well, during the COVID-19 pandemic, we studied travel nurses on the front lines. Their rates of depression, near 1 out of 3, anxiety, almost 40%, and burnout was 65%. But here's another finding that's so critical. Nurses who perceived that their work site supported their well-being, they were less likely to report a negative impact of COVID-19 on their healthy lifestyle behaviors. So before the pandemic, the National Academy of Medicine said, we do have an epidemic of these problems in physicians, in nurses, in other healthcare providers. They launched a national action collaborative on clinician well-being and resilience. If you're not plugged in to this collaborative, I encourage you to do that. I was blessed to be one of 60 leaders appointed to serve on this action collaborative. Just 2 weeks ago, we actually put together a beautiful resource compendium, resources for healthcare worker well-being under 6 key categories. I really encourage all of you to check that clearinghouse of resources out. Well, there's tons of causes of burnout and distress amongst healthcare professionals, increased clinical demands, too many bureaucratic tasks, poorly functioning teams, decreased time with patients because of too many tasks, problems with the electronic medical record, isolation, and character builders balancing personal and professional life. Other consequences of burnout on clinicians and our students: depression, which really increases the risk of suicide, problematic alcohol, even drug use, occupational injury. But for healthcare organizations, problems with absenteeism, turnover, presenteeism, people showing up physically for work, but they're not fully engaged. And then, as I mentioned, burnout lowers patient care quality and safety. We spend $4.6 billion a year in our healthcare system on clinician burnout. This alone needs urgent action. Now I want to talk about the current state, particularly of mental health in our college population. This is data from the Healthy Mind Study in 2021. They surveyed over 100,000 college students from across the country. They used valid and reliable tools to measure depression, anxiety. 41% of these students reported or screened positive for depression. 34% screened positive for clinical anxiety. 13% reported suicidal ideation. What's really important too is almost half of these students agreed that most people would think less of someone who has received mental health treatment. So even though we're in 2022, mental health stigma is still alive and well. Suicide is the second leading cause of death in 10 to 34-year-olds. In Colorado, they declared a public health emergency because suicide rose to the top number one cause of death in young people. And what's really important to know, 25% of young adults have considered suicide since the pandemic began. We've got to make sure everybody has the National Suicide Prevention Hotline plugged in into their iPhone, because you never know when you're going to need it. A recent Harvard poll found 1 in 2 reported feeling down, depressed, or hopeless in the past 2 weeks. 2/3 of students who drop out of college do so because of a mental health problem. And nearly 75% of our young adults with depression also suffer from anxiety. So anymore, we don't just deal with one mental health issue. There's a probability there are 2 comorbidities that exist. Causes of burnout and distress in college students, our learning environment, our grading systems, lack of social support, faculty who maybe aren't super supportive of well-being, cultural insensitivity. We have tremendous health disparities with underrepresented students reporting higher levels of depression and anxiety. Personal factors, students who just don't have evidence-based CBT skills, mindfulness skills, resiliency skills. Financial stress is a big one. Personal illness, family-related stress. And then thirdly, impacted learning environments and personal issues related to COVID-19. So one of the things, the very least that we can do when we see a student who looks depressed, really anxious, or stressed, ask the simple question, are you okay today? Just that one simple question often enables a student or a colleague to open up. We have a wonderful REACH suicide prevention program here at Ohio State, where we encourage everybody to recognize warning signs, engage with empathy, ask directly, do you have any thoughts about killing yourself or harming yourself? Communicate hope and help suicidal people to access care and treatment. Well, COVID has imposed even more stress on everybody. In addition to mental health problems, people have attempted to cope with COVID with unhealthy lifestyle behaviors. Alcohol use is up. Suicide's up, especially in our young people. Unhealthy eating is up, and there's been declines in physical activity. And what's that is going to mean for our country 2 to 3 years from now is higher rates of chronic disease. I like to use this analogy. We would never send divers into a deep ocean without an oxygen tank. How can we send our students throughout life without giving them evidence-based skills, mental health, resiliency skills that we know are protective for mental health issues? This can no longer be an option. We as faculty, we've got to figure out, how do we integrate these skills into the academic curricula so that all our students get them? We know what works. Our team published a systematic review on what works to improve mental health, healthy behaviors in physicians, nurses. These 6 things work, but we still have this long research to practice time gap till we translate what we know works into the real world. We've got to accelerate that. The latest study shows instead of the 17-year time gap, we have a 15-year time gap. Let's not wait to get many of these evidence-based interventions into the curricula for our students. I'm going to finish this talk with a focus on faculty staff wellness. You all do a great job at what you're doing, but so often we don't prioritize our own self-care. Self-care is not selfish. It shouldn't be a nicety. It's a necessity. And if we as faculty and staff, we don't walk the talk, we don't integrate wellness in our cultures, in our curricula, we're still going to be struggling with these issues 5 to 10 years from now. We must take good self-care because we cannot pour from an empty cup. So I want you to be honest with yourself and take a look at this one item valid burnout scale. How would you rate your level of burnout right now? If you're falling into the 3, 4, or 5 category, you really want to get some help. It is not a weakness to seek help. It's a strength to recognize when we need help and to seek it out. I always like to build in a skill or a charge for the next 30 days because the root cause of so much stress, anxiety, and depression are negative patterns of thinking. I'm going to encourage all of you, when you experience stress, anxiety, anger, or depression, stop and say to yourself, what was just going through my mind? Is this thought really true? Is this thinking helpful? And do I have the evidence to back it up? Chances are the answer to those questions are going to be no. So the key is catching, checking, and changing these automatic negative thoughts around to positive thoughts. That's a brief evidence-based strategy that can really work well. On this slide, I just give you some other key strategies for dealing with burnout, or if you're languishing. Don't feel guilty about saying no. I was raised Catholic. I struggled for years with guilt about saying no, sincerely. We often overcommit, and we do everything we can to follow through, but then we personally suffer for it. So we've got to set some good boundaries, and we've got to build in daily, even if it's 10 minutes, a little time, do some physical activity, cut 60-minute meetings down to 50 minutes. So you have 10 minutes of recovery time to do something that brings you joy or diminishes your stress. Take and give a dose of vitamin G every day, because we know all the benefits associated with the regular practice of gratitude. Well, cardiovascular disease is still our number one killer. But when you consider all causes of death and disease in this country, it's really our behaviors that are the number one killer. And I'm serious when I say beware of your chair. Get your students standing more during your class sessions. Get them up and move. Sitting 3 hours a day increases our cardiac risk by 30%. Many of you have worked on behavior change strategies. You're aware that facts alone often don't get people to change. It's evidence plus emotions that get people to change. Most people don't change unless crisis happens. So I'd like you to think about your own healthy behaviors as you watch this short clip. What are the last 10 years of your life going to look like if you keep doing or not doing certain things?
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide.
That's very powerful. What we do every day will determine our state of health those last 10 years. I didn't fabricate this slide. It's a real fitness facility in the state of California. A group of psychologists studied how many people in the course of a day of a week chose the stairs instead of the escalator. They're finding 2 people a day. So I'm going to finish by giving you a great evidence-based recipe. If you can just do these healthy lifestyle behaviors, we could reduce chronic disease by 80%. You might say, Burn, you're crazy. I can't do 30 minutes, 5 days a week of physical activity. And I would say to you, you can do it. Cut 60-minute meetings down to 50 minutes, at least 3 times a day. Then you'd have 3 10-minute blocks of time to take a brisk walk the stairs. And if you drink, it's really important, limit it, and that's alcohol, to 1 drink a day. Standard drinks, not the size of the drinks they serve us in Las Vegas. I'm going to end by asking you, think about which one of the behaviors I just showed can you get just a little better at. Make today your January 1. Write it down. I, Bernadette Melnyk, commit to increasing my physical activity from 10 minutes twice a week to 10 minutes 3 times a week. But write it down. Put it where you can see it every day, because visual triggers help us to meet our goals. My mom stroked out right in front of me when I was 15 years of age, home alone with her. She sneezed, bam, she was out. But the really sad thing about my mom's story, she had a history of headaches for over a year. My dad kept saying, go to the doctors, figure out what's wrong. She went to our family physician 1 week before she died, diagnosed with high blood pressure, given a prescription for a blood pressure medication that my dad found in her purse after she died. That's why I'm so passionate about wellness and prevention. So if you're not motivated to engage just a little bit more in healthy behaviors yourself, put your family in front of you. Do it for them because they want you to be around a long time. We have our 3rd biennial national summit on promoting well-being and resilience in clinicians coming up September 28th to 30th. The call for abstracts is currently out. We also have a fabulous national organization called BHAC, where universities, colleges throughout the country join. We take a comprehensive approach to improving population health and well-being for faculty, staff, and students. And if I couldn't motivate you enough, this little girl will actually do it.
Do it! Just do it! Don't let your dreams be dreams. Yesterday you said tomorrow. So just it. Make your dreams come true. Just do it. Some people dreamers are obsessed. And you're going to wake up and we're going to work hard at it. Nothing is impossible. You should get to a point where anyone else will quit. And you're not going to stop there. No, what are you waiting for? Just do it. Just do it. Yes, you can. Just do it.
And for regular doses of motivation, follow me on Twitter at Bernadette Melnyk. For those of you who would like CE for this series, please complete the evaluation that will follow. Thanks, everybody. Join us for another Wellness Wednesday session next week. And by all means, stay well.